All right. So when we're talking about Week 5 NFL injuries, look, we see them every week, right? They continue to amass, and I thought rather than just hear me talk to myself about this or anything else, I wanted to bring in an expert to be able to talk with us about NFL injuries. And I decided to bring in one of the best. This gentleman's been featured on ESPN, CBS Sports, all over the place. A sports medicine physician and a regenerative medicine specialist, Dr. Jesse Morse. Thank you, Dr. Morse, for being able to join today.
My pleasure. Thank you for having me.
Well, I was excited to be able to talk with you about some of these injuries because I do think, you put something out on Twitter, or I guess we call it X now, but and it was specific to Anthony Richardson and his shoulder injury. And one of the things you were kind of mentioning on there is the fact that kind of previous injury history will tell us a lot about future injury history. And I thought that was really interesting because I think as fans just within sports, a lot of times you just kind of look at it like either a guy's unlucky or, man, he's just kind of injury prone. But I thought before we get into a few of the specifics, I was wondering if you could maybe just take a second to touch on maybe why that is, that if a guy has a history of injury, there's a high likelihood that that's going to continue.
So the body only has the ability to heal at about a rate of 85%. So after you've stopped healing, or after you injure a healthy body part, you'll only be 85% perfect from that point forward. And a lot of that has to do with scar tissue. So the issue with scar tissue is it's not as flexible and it's not as strong. So it's the weakest link. And eventually, if something's going to give, it's probably going to be scar tissue because it's the weakest link. And then you end up re-injuring the same injury over and over and over again. And every time it heals, the body puts on more scar tissue, sometimes calcium, which is what bones are made of. And then that becomes the weakest link, and then you re-tear it, and you have this vicious cycle, and it never gets back to perfect or 100%. So you always have an area that can't handle the load you're asking it to handle. So when Anthony Richardson, we'll use this example, when he injured his right throwing shoulder twice over the period of 2 years when he was in high school, yes, we're going back to high school, the problem is the body is like, well, this is the best I can do, and it put in scar tissue. So now those ligaments that hold the AC joint together, which are responsible for the throwing motion, those ligaments have more laxity, or think of an elastic band, and it's supposed to be this tight, and eventually you stretch it, so now it has more play. And the problem is that scar tissue is building up on each side where it attaches to the bone, and now when you injure it, it tears. So now the bone kind of goes wherever gravity brings it. And depending on the level of how many ligaments are partially or fully torn will depend on the type or grade. It's usually type for this type of injury. And the higher the number, the worse the injury is. So type 2s are frustrating, but not the end of the world. Type 3s are bad. Type 3s are 50-50 chance you're going to need surgery. For an elite caliber of this in his throwing shoulder on a rookie contract, 3 to 4, fourth pick or whatever he was.
Yeah.
Do you want to just hope that he doesn't land on it again in a month? I would not be surprised if they end up, this is tricky. Half of them would say, hey, let's go to surgery, and half would say, hey, let's, just hope that it heals properly. He went to see Dr. Meister, who's a famous orthopedic surgeon in Texas that does a lot of, he's the Texas Rangers doc, but he also does a lot of pros. That's who did Brock Purdy's elbow. That's who did Dak Prescott's lat a couple years ago. He consulted him. So he's kind of a shoulder or elbow specialist. And as a result, they're going to get an opinion in there. And then from there, they're going to decide, hey, surgery or no surgery. And from that point forward, we'll know, is it going to be out a month or is this going to be season ending? That's what we're going to hear from there.
Interesting. Now, so from your experience, if say an Anthony Richardson goes and he gets checked out and that doctor recommends surgery, at that point, is it just kind of like that is what it is, or is an Anthony Richardson going to say, well, I'm going to go to a second, I'm going to go to a third?
So Meister
do a lot of guys try to find?
Yeah, so Meister was likely the second opinion. So the in-house team docs will give the first opinion. There's usually 4 team docs in-house. There's 2 orthopedic surgeons and there's 2 non-surgicals, which is what I am. And so Usually the surgeon or non-surgeon or both will make the recommendations, and then usually either GM, owner, or agent or player will say, hey, I want to get a second thing if they don't like the answer or they just want another opinion, and then they'll get one. Sometimes they get a third or fourth opinion. Sometimes I get consulted as a third or fourth opinion, and I give my thoughts, and sometimes I never hear from them again, but it is what it is. And then at that point, they go with the best option that they think is best for them, for the player.
Got it. And so just out of curiosity, it just popped into my head just as you were talking. So for yourself, right, you've been a third, a fourth opinion for somebody. Would you meet with the person, or is it a thing where they send you the x-rays, the results, and then you just look at it?
Yep. A lot of these players can't fly. I mean, they can, but Zoom is just like this, very helpful. Right. They'll send me the info, and then I'll review it, and then I'll Zoom with them, talk with them, so on and so forth, and that type of stuff. Then sometimes if I live in Miami, so a lot of players live here or don't mind traveling here, and they will fly down and you get evaluated. And then sometimes you'll have the agent or somebody, trainer, physical therapist, sometimes I call him a trainer, to send it and say, hey, can you check out my guy and see what you recommend? And within reason, I usually can give them a good gauge, just based on knowing what I know about them, what the severity of the injury, knowing what I know about the body and how it heals, and knowing what I specialize in stem cells, so knowing what I know about, hey, if I can't fix it with stem cells, then you're not going to be able to fix it with stem cells in the United States. I'm super aggressive, and I have access to whatever I want. So the only time it's going to be either surgery, straight PT, or stem cells. Those are basically traditionally the three options, depending on the body part. Sure. So I'm going to give them the regenerative recommendation. And they're all, all the regenerative are probably going to be relatively comparable. Surgeries that usually depend on the surgeon, and then PT or the non-surgicals a lot of the times are going to be very similar. Got it.
Interesting. So from the stem cell side, we don't have to go too far into this, but it is part of obviously regenerative, care. Would you, in your mind and in your area of expertise here, is pretty much every type of injury a good candidate for stem cell therapy, whether it's an AC joint in an Anthony Richardson or a Devon Achan's knee, is it any injury?
Most people don't understand stem cells, so I'll start with that. What are stem cells? We're not injecting cells that can go in and create brand new tissue or whatever type of tissue they want. Those are unstable and unhealthy. You should not do those. Okay. That's what people think they are. In actuality, think of them as what we call MSCs or what we used to call mesenchymal stem cells. The proper term is really medicinal signaling cells. So what those are, basically, think of it as the ultimate traffic cop. Hey, I see an injury there. Hey, here's all these growth factors you need to go to fix. You go there, you go there, you go there. And it's kind of coordinating with your stem cells of whatever the location is to give you the nutrients it needs. And then you put the needle exactly where it needs to go. And then you're delivering those products. The issue is, does the body, the stronger the product, the worse the injury, the stronger the product needed. So you have different levels, but in general, you have your, what we call prolotherapy, which is relatively mild. Then you have your PRPs, which is from the blood. And then you have your stem cell lines. And each one's about a 3x above the other in terms of potency. Your stem cell lines is obviously the strongest. And then you have a couple from you. You have adipose or fat, and then you have bone marrow. And then the not from you, amniotic is probably the most popular, in my opinion, the most potent. You can do Wharton's jelly, which is similar, but not quite as potent in my opinion. And then you have something called exosomes, which are kind of like a placental-based product. And each of these work in a different manner, but they all achieve the same goal, but the results and the timing is a little different. The ones from you are really inflammatory, so they take time to heal. But they're coming out of you and they're going back in you. So you're just borrowing and relocating it. PRP is not true stem cell, but it does a great job at mild to moderate injuries. Whereas something like an amniotic or an exosome are non-inflammatory. So there are billions of growth factors and even actual tissue that goes in and kind of creates a scaffold. So you're kind of like building on top of it. And a lot of times we'll mix and match them depending on the the severity of the injury, the caliber of the person you're dealing with. Do they need to be on the field? Do they just want to be playing tennis? Whatever it is. And unfortunately, cost plays a role as well. But these are, yes, you can pretty much put them anywhere. There's certain places you should not put them, but in general, you can put them anywhere because the basis of the injury is usually the same. You just have to step back and say why. And the reason is usually instability. So think of it as you're sitting on a bar stool, and we'll say this is your knee. The bar stool, 3 of the 4 legs are really loose, and you're like, that's true instability. You have no idea where that bar stool is going to go. Any way you lean, it could go any which way, and you could be falling off. Think of the bolts as the ligaments.
Okay.
So if those ligaments are really loose, then you're going to have a heck of a time being stable. And what happens is the body cannot restabilize or cannot build new ligaments because it has a poor blood supply. So what happens is the body ends up using the muscles as protectors. So it's like, hey, we don't want you to be unstable. We're going to spasm and prevent that injury from getting worse. So that's why you get
compensating for what the ligaments aren't doing.
Exactly. So that's why you say in your low back, that's why you get a lot of low back spasms, because that ligament can't handle the load and the muscle's trying to protect it. So it goes into protection mode. And eventually once if the tissue gets restabilized, whether it's through PT or surgery or stem cells, then the body's like, oh, okay, now you're stable. Now I can go back into movement and I don't have to protect anymore. And it doesn't happen slowly. It can take 3 months, 6 months, depending on the severity of injury and what you're doing to it. But the key is choosing the right product, having the diagnosis, and injecting it in the right manner. That's the trick.
Okay.
There's no book. There's no course. This is just experience and collected things along the way.
Wow. Yeah. That's really interesting because, you touched on this a little while ago as it pertains to, Anthony Richardson having a history of those shoulder injuries going all the way back to high school.
Yep.
And when it is his throwing shoulder, one of the things that I thought was interesting, you said the body will only heal back approximately 85%.
Yeah.
When you have multiple injuries, is it only now the second injury is only 85% of the 85%, and then it just kind of continues to scale down?
That's a good question. I don't know if we know that answer, but I just think of it as, and whenever I consult someone and say, hey, we're going to try to fix this injury, but I won't be able to get it like you were 15.
Right.
I'm going to be able to get it as strong as I can get it now. And that should be plenty enough to allow you to do whatever you want to do and not have to worry about it. Yeah. But I can't promise that it's going to be like you were 15, like it was brand new. I can't. Right. Unlike, oftentimes I use the analogy of a car or a tire. I say, your meniscus, you've been using your meniscus every day since you were 15. Think of driving a car for 20 years, never changing the tires. Of course they're going to be beat up. But you have the luxury of changing the tires whenever you want. You can't do that with your meniscus. Yeah. So the best you can do is prevent them from getting worse using something that allows them to stay as strong as you can, or reversing is tricky, but so in that regard, it gets a little tricky. So I'm trying to be just as reactive as I am proactive. And the problem with the pros is a lot of them are not like that because they're used to being freaks. They're the best player on their team for so many years, and now they're getting hit by dudes just as fast and strong and big as them. And they're one injury away from being replaced. And now they are, James Conner just went to IR. It just popped up. And then the problem is you just keep playing catch up. You really can't make any progress because every time you injure it, you keep getting that percentage less. So, I had a lady yesterday with a rotator cuff. And the problem is, think of that as a big rope, to make it easy. There's 4 big ropes. And the problem is that rope, say it's 50% remaining. Okay? But the problem is your shoulder is asking it to do 100% of the work. So what happens?
Yeah, it doesn't work fair. That math isn't good.
That rope keeps fraying because you keep asking it to do 100% of the work. Wow. The other muscles try to help out, but they can only do so much. They have their own job.
Sure.
So that's part of the problem. is that you see that number or strength or, and eventually it can't do that anymore, and it eventually tears, or it just causes you pain where you don't want to do anything.
Wow.
And sometimes it's freak, it's trauma, and sometimes it's slow, degrading, degenerating process.
Yeah, and I would think that, so many times too, one injury or compensating for one injury can easily create another injury, right? And what I'm thinking of specifically, we all know Aaron Rodgers, obviously, with the Achilles injury, but, I've heard it said many times, and maybe you can speak to it a little bit, that calf weakness often causes Achilles injuries. And I know that Aaron Rodgers had an issue with his calf in training camp and then ends up with an Achilles injury. And I thought it was very interesting that the Bengals still continued to put Joe Burrow out early in the season, knowing that calf injury, because it seemed like there was tremendous risk of an Achilles injury there. So do you see a lot of those kind of compounding injuries a lot of times?
Yes. I'll give you an example. Initially, when I thought a chains injury, when I seen it initially, it looked like a high ankle. It looked like a mild high ankle because of the stress of the ankle. But then when you look at the mechanics and the stress, when you invert that ankle, you put more stress on the knee. So what happened is maybe his ankle got lucky, but the knee didn't.
Right.
And that's likely what happened. So going back to the Achilles, there isn't a direct correlation between calf issues and Achilles. It's indirect. And in my opinion, the muscle turns from a gastroc to eventually tapers into the Achilles. But if that gastroc is getting, say, 100 Newton meters of force and it's weak and it can't handle that, well, it's going to translate that energy. And if it goes distally in whatever the weakest point is, that's what's going to get injured. Well, if your Achilles is weak, you tear your Achilles. If your gastroc can handle that 100 Newton meters of force, it's fine. You run and you have the play, and it doesn't matter. So that's kind of where it gets tricky. So and we saw that, and we see a lot of compensating. J.K. Dobbins had ACL on one side and had Achilles on the other side. We saw Tariq Cohen, similar situation. So, yes, there was a lot of compensating. Javonte Williams, with his bad ACL, just injured his hip flexor. Is there a mechanical issue to him? Is he, because his knee doesn't have the same strength as it should get, is his hip flexors, which are basically the muscles that pick your leg up and rotate them, were those working harder than they needed to, and eventually it's strained, and that's it. So, so that's part of what a good PT does, is that they're able to kind of analyze, hey, yes, I know your knee problem is in your knee, but the problem actually starts in your hip, or the problem starts in your back. And if you don't correct that, this knee will never really truly be fixed, because you're always putting more force on it. So you have to go up chain or sometimes down chain, depending on the body part.
Wow. So essentially then, with Anthony Richardson, we're at a point now where it's very possible that surgery will be necessary for him, in your opinion, from what you know.
It depends on how aggressive they want to be, and it really depends on the severity of the damage and of the shifting of the clavicle. That's really what it depends on. If the clavicle is shifted any horizontally, then he probably needs surgery. If it's only shifted vertically, meaning up, then he probably will be okay.
Got it.
My biggest fear, if I am spending that much capital on him and that much hope on him, he's played in 4 games out of a possible 5. The first game, he injured his ankle on his knee. The third game, he suffered a concussion. And in the 5th game, he landed really hard on his shoulder.
Yeah.
Okay, now I decide to bring up his injury history because no one knew about it before, right? It was quote-unquote irrelevant. But when you start to add all those other ones up, now, we haven't even looked at his knee. We haven't looked at his hamstring, which has a significant history. Is this something about his healing ability? The other part of my practice is genetics, and not really genetics, but more so healing, toxicities, ability to heal or not heal. And some players or some people do not heal as well as other people, whether it's lead poisoning or mercury or, Lyme or whatever the reason is.
Sure.
So, then you start looking at, hey, I know he's a freak athlete. There's no question about that. But why is he getting why is he suffering so injuries? Why is he not healing? And you can fix that shoulder until it's perfect. But if he has a healing deficiency, you're never going to really get him to be able to play like a Josh Allen or Patrick Mahomes or someone who's never going to miss a game unless you cut off his arm, because they know that they can heal better than most people. So it's kind of opening a can of worms, but that's what I do with my pros. Like, if you want the full analysis, you're going to do some testing, but you're going to find out stuff that you don't know about yourself, and you'd rather know than not know. And one of my favorite phrases is, you don't know what you don't know.
That's right.
I mean, if you don't test for it, I can't tell you if you have it or don't have it. I can't tell you if, and these guys are worth millions and millions of dollars, so it's not really a big deal. Regular people, it gets expensive. But it's tough. I mean, we don't really know which way this Anthony Richardson situation is going to go. One doc could say, hey, he's fine, give him a month off. And the other docs would say, hey, he probably should need surgery. And then the question is, which one do they want to do? And then you have some, and I won't name any names because he's super famous, but there's some players that are old school. They think the body should heal itself and you shouldn't really need to help it. So maybe you recommended surgery or an injection or whatever, and they said, no, if it didn't heal, the body will heal it on its own. So now you're increasing the risk because you don't believe in XYZ.
Got it.
That plays a role in it too.
Yeah, that does make a lot of sense. Wow, you've given us a lot of interesting things here to think about, because it is the topic of sports injuries is just not only a fascinating one, and I think what you do that I really like and I think is so interesting is, you talk a lot about the impact of injuries on, fantasy football teams and things like that. I mean, you have the site, thefantasydoctors.com, where, you can literally talk about like, hey, here's how long this type of injury is probably going to keep a player out, and, and have some awareness of that, which is pretty fascinating. That it's such an interesting kind of segment that I think is only going to grow in importance, when we look at just the sheer value, the amount of money that's being paid to players. Naturally, injury, healing, all of those types of things is just going to be a huge portion of the marketplace, moving forward. So I think that's really interesting.
And a lot of these guys, this is it's a vicious sport, right? There's no question. Yeah. But why don't these guys spend 3-4 hours and get their full bottle analyzed? What is it, 1,000, 2,000, whatever it is. Right. But whatever that is, I promise you it's significantly less than a game check. Whatever it is. That's right. It don't matter. So it's like, a lot of these things you can predict. I can't tell you when it's going to happen. I can't tell you the severity, but I can tell you that if you don't address that issue, it's going to come back to you, whether it's sooner than later. Yeah. And if it's a bad injury like an Achilles, it's really going to cause a destroy. I had a pro in here the other day. His knee, I could do this to it. You should not be able to do that to a knee.
Wow.
And so that means his ACL's loose. Yeah, now, he might not have known it. He would say, hey, this is just how I am. But I can tell you his knee should not be that loose. Right. So in that regard, I don't want to scare him, but I kind of want to scare him because, if he doesn't know that his ACL is loose and then all of a sudden he tears his ACL, it's like, well, I didn't know why. I mean, yes, I could have told you that because he was super loose. Whether or not you wanted to do something about it is kind of up to you.
Right.
But interesting. That's something, and a lot of docs I don't do any traditional medicine at all anymore. No Band-Aids, no steroids, nothing like that. So a lot of those are temporary solutions. Oh, let's Band-Aid it and let's hope the body fixes itself. No. Yeah. That's just kicking the can down the road. You're telling your brain, hey, you don't have pain. But in actuality, not only do you have pain, but now you're making a mild injury moderate because you're pushing through that reminder, don't do that, because the steroid just told you not to do that. Wow. But the steroid's overriding that reminder, hey, don't do that. Right. So, and that's the easy way to do it. Man. But that's the problem. Sure. That's
versus the problem. Not treating it, you're just masking it.
No. You're turning a blind eye to it. This is temporary solutions.
Wow.
And the problem is that's how traditional medicine is based. Cortisone, maybe a gel injection for the knee. Oh, let's do surgery. Let's do PT. That's your option.
Right.
You have not once actually helped that tissue unless you reconstructed it in the OR. And then you have your own set of headaches with scar tissue and, so on and so forth. And that's part of the problem. They don't want to fix the root cause. They just want to Band-Aid it and get you back out there until it breaks again.
Get back out on the field, keep going. Yeah. Wow.
And that's why all of these pros have their own docs like me. Because the traditional docs are not going to approach things like me because there's 50, 60 guys on the team. There's no way you can spend that much time with them each week. That's not possible.
Yeah. No.
So, a long-winded answer, but yeah.
Interesting. So let's do this. Before we wrap up, one last one I wanted to touch on is just Justin Jefferson's hamstring injury. We see hamstrings, obviously a major problem in all of pro sports, certainly in the NFL, particularly early in the season a lot of times. Is there much, you always hear that there's just not a lot you can do with hamstrings other than just give it time. That's kind of the solution. From your experience and your knowledge and expertise, what do you do? How do you treat a hamstring injury? Is there much you can do to speed up that process?
Oh, yeah.
Oh, really?
Oh, yeah. There's a lot of stuff you can do. I need you to look at the hips and see if they're rotated. So think about it this way. If one hip is higher than the other, and those hamstrings don't get any longer, that higher hip means that hamstring tendon is under more tension. Right. So which one is going to likely tear faster?
Sure, yeah, that tighter one.
Right? So now the IT band, which is that stupid thing that runs up and down the side of your leg that's super tight, that tightness correlates with hamstring tightness. The tighter that is, the tighter the hamstring is going to be. Yeah. The problem with a lot of these guys is they're not pushing it often enough. They baby it. And then the team asks them to go 100%, and that tissue's not ready. It's like you wake up, you start a car that's been an engine for 3 months in the cold winter, and then you say redline it for 20 minutes straight. Right. There's no way that engine's going to be able to handle that. It's like, bro, I need to be going. I need to get lubricated. And that's part of the problem. That tissue is not ready to handle that load. I would inject the hell out of it. The tissue is very unique. The hamstring in particular, because the hamstring usually goes from bone, tendon, muscle, tendon, bone. That's traditional. Okay. This goes bone, tendon, muscle, tendon, muscle. Bone. Oh, wow. So there's a huge, what we call myotendinous junction in the middle of the hamstring for the biceps femoris, which is the big one. And that's usually what guys injure because the tendon doesn't have a good blood supply, just like an Achilles, just like a rotator cuff, just like a patellar. It doesn't have a good blood supply. So what does it do? It scars. And we go back to the scar. So what happens? You force it, whatever the weakest link is, that's where it tears. And then you throw, so think of Julio Jones. Then you throw more scar tissue on. Then you run again, and what happens? You tear it again. And then you have this vicious cycle. Wow. So what you do is you beat up that scar tissue with the needle. And then you inject PRP or you inject stem cells, whatever you want, to try to get that tissue as healthy as you can. Maybe you inject that where it attaches to the hip. Maybe you inject where it attaches to the knee. I know it's aggressive, but sometimes you got to do what you got to do. You got to correct those hips. Make sure that tailbone is aligned because there's connections to all this stuff. It's not just, oh, hey, let's do some, reverse curls or Nordics or whatever, and then he'll be back. No, you're begging to injure that hamstring again. And that's why these guys injure them so often because they don't go above and beyond to really hit these things hard. And then they eventually, the first 6 weeks of the season are by far the riskiest because of soft tissue injuries. And we see that every week. Every week is a different soft tissue injury. Aaron Jones just missed another week. Now Jefferson's out. Mike Evans is out. You name a guy, you name it. All these guys in some capacity. Look, Cooper Kupp. So there's different levels to this, and unfortunately, common things are common. Look at soft tissue injuries: hamstring, groin, quad, calf.
Yeah.
Joe Burrow, Cooper Kupp, Miles Sanders, George Kittle had a bad groin. Thankfully, quads aren't super common, but you can strain them. But that's the problem is that you need those for explosive actions, but they don't heal well and they re-injure easily, especially areas that don't have a good blood supply, like the calf, like the groin.
Right. Man, well, this is this is interesting stuff. We could go a long time. I want to be conscious. I know you had some other obligations, but this is fascinating stuff. I think there's a whole other side of this that, maybe if you're ever down for it, we'd love to have you back on some time to be able to discuss really that role of stem cells in healing and, the attitude toward it in America versus other countries. I know in other places in Europe, the stem cells are treated so totally differently as part of the healing process. But I do want to make sure that people know to check you out. Dr. Jesse Morse, Morse on
Correct.
Twitter.
Yep. And I'm on Instagram and some of the other ones, but Twitter's my primary.
Okay.
And we have a TikTok, we have YouTube and whatnot, but in terms of medical stuff, I don't really put a whole lot out. True medicine, I end up it's more injury related. But my practice is in Miami. This is what I do. This is what I love, as you can tell. And it's deeper than a Band-Aid. Unfortunately, some people aren't willing to go down that journey, but they'll probably never really be happy with that injury until they truly fix it to the point where they're not worried about it anymore.
No, that's super. Yeah, I think you make a great point there. And, and like I said before, I'm going to encourage everyone to check out your Twitter, check out thefantasydoctors.com, because you are one of these, kind of rare, breeds where you are a medical expert, but you also can talk like we have been talking NFL and injuries and knowing player histories and those types of things, which is fascinating. And, it's an interesting read. I highly recommend people check you out again on Twitter, on thefantasydoctors.com. And Lord knows, you're all over the place elsewhere as well, brought in as an expert. So really, really appreciate your time today, Dr. Morse. Thank you so much for this. Super, super enlightening, and a lot of interesting stuff here to look ahead as we see how these players do end up coming back from these injuries.
Oh, yeah. My pleasure.